When I had a stroke, doctors kept asking if I had high blood pressure, if I had diabetes, or I used recreational drugs. One asked me if I took Posino 2 regularly. I was confused. But now I know better. I understand better, and I think I know why they asked so much questions. They wanted to know what would have caused a stroke. That being said, let's move to the main topic of discussion. Welcome to my stroke story. My name is Ada Ame and I am a stroke survivor. Today, I want to talk to you about stroke risk factors. A stroke occurs when blood flow to the brain is disrupted, leading to brain cells damage or death. Strokes happens suddenly and can happen to anyone, regardless of one's age, regardless of one's race, regardless of one's ethnicity, regardless of one's financial status. There are certain things that increases one's chances or likelihood of having a stroke, and they are called stroke risk factors. For example, if you have a 0% chance of having a stroke, there are certain things or factors that can increase that 0% to 30% to 50% to 70% to 99%, even 100%. I am not here to scare anyone. I just think it is important to know these stroke factors so as to prevent stroke occurrence. It is also important to know that while these factors increase the likelihood of stroke occurrence, they do not guarantee its occurrence. I repeat, for a fact that these risk factors increases chances of stroke occurrence, they don't guarantee that if you have two or more of these stroke risk factors, you will definitely have a stroke. You just need to know this so as to manage your health properly so it doesn't result to a stroke. If you've not had a stroke, I would advise you to know and understand these risk factors as to protect yourself and your loved ones from having a stroke. And if you've already had a stroke, you should know that you are at risk of having another stroke. And we definitely don't want that. Remember, to be forewarned is to be forearmed. In this video, I'll be talking about 10 common stroke risk factors. Number one, high blood pressure, also known as hypertension. Uncontrolled high blood pressure is the most common recorded cause of strokes. A blood pressure of 140/90 can lead to damaged blood vessels, which can lead to the disruption of blood supply to the brain, leading to a stroke. Number two, smoking. Smoking damages your blood vessels and increases the likelihood of blood clots, which can lead to a stroke. It is said that smoking doubles your chances of having an ischemic stroke, which makes sense to me because smoking can lead to blood clot formation, which can block the blood vessels leading to a stroke. Number three, diabetes, also known as high blood sugar level. People with diabetes are at a higher risk of having a stroke due to complications such as high blood pressure and kidney disease. Number four, high cholesterol levels. Elevated levels of cholesterol can lead to the formation of fatty deposits in the blood vessels, which can cause a buildup of plaques and decrease blood flow or blood supply to the brain, therefore increasing one's risk of having a stroke. Number five, obesity. Being overweight can lead to other complications such as high blood pressure, diabetes, and high cholesterol, therefore leading to a stroke in the long run. Number six, physical inactivity or lack of regular exercise. This can lead to poor cardiovascular health, which can lead to a stroke. It can also lead to weight gain, which can lead to other risk factors, just as we spoke earlier, can lead to a stroke. Number seven, some heart diseases like coronary artery disease, arterial fibrillation, and heart defects can increase the risk of stroke. Arterial fibrillation is an irregular rapid heart rhythm that causes poor blood flow. It is said to be the most powerful heart risk factor for stroke and a major cause of death among stroke survivors. Google records about 100,000 cases in Nigeria yearly, which I personally think is a lot. Number eight, family history. People who have a family history of stroke or certain genetic disorders are more likely to have a stroke than people who do not. For example, if two or more of your family members or your relatives your uncle, your auntie, your brother, your sister, your father, your mother, your grandparents, anybody has had a stroke in the past, you should be watchful as you are more likely to have a stroke than one who does not have any. Number nine is age and gender. It is said that older people are more likely to have a stroke than younger people, and men are at a higher risk of having a stroke than women. Although this table turns as they get older, older women are more likely to have a stroke than younger men. I think it has to do with the fact that women live longer than men. We have a lot of older women. I hope that makes sense. Number 10, TIAs, also known as transient ischemic attack. This is known as a mini stroke. It occurs with little or no symptoms and resolves on their own. A huge indicator. They said that a person who has had a TIA is 10 times more likely to have a stroke than a person who has not had TIA. Now, my bonus point is people who have a history of stroke. Now, if you've had a stroke before, you are more likely to have another stroke than an individual who has not had a stroke before. That being said, we have other risk factors such as excessive alcohol intake, high stress levels, eating of unhealthy foods, certain health conditions such as sickle cell, drug abuse, use of recreational drugs such as cocaine, through venous malfunctions, inflammation, use of birth control pills, and hormonal replacement therapy. Now, for every woman out there, I hope you are aware that excessive intake of morning after pills can result to a stroke. That being said, these are the risk factors I will be talking about in another video. Remember, I always say that to tackle something, you need to understand its nature and how it operates. I hope you find this little information helpful. I need you to stay informed and make choices that can reduce your chances of having a stroke or having another stroke if you've already had a stroke. Please like and share my videos. Remember to subscribe, and any suggestion would be welcomed at the comment section. Do have a wonderful day and week ahead. Thank you. Disclaimer, I am not a medical doctor, neither did I study medicine. I am just a stroke survivor who loves to talk about stroke.